you should be taking care of your neighbors. You should be caring for other people. And when the name Matthew 25 was developed, it was developed around that whole Bible verse. And I believe that's what we do every single day.
This is a special treat. This episode features Sally Welch. Sally is the longest serving staff member at Matthew 25. She was there in its humble beginnings and has remained there through its transformations. In our time, Sally shares the organization's evolution from operating bare bones on a shoestring budget to serving hundreds of patients in life-saving, life-affirming work. Matthew 25 is a healthcare organization based in Western Kentucky and Southern Indiana. It was started in 1996 by Sydney Burton, a nurse at the time moved by her Christian faith and a call to service. The organization serves those who are at risk for living with or impacted by HIV and other STIs through comprehensive healthcare, education, and support, while fostering community partnerships to combat stigma and improve overall healthcare and quality of life. And who am I? I'm Stephen Hicks with the STD HIV Prevention Training Center at Johns Hopkins, a CDC-funded regional training center with the national network of STD Clinical Prevention Training Centers, NNPTC. Thank you for listening.
My name is Sally Welch. I am the Director of Community Services here at Matthew 25.
Mm-hmm. And how long have you been with Matthew 25?
Next month it will be 22 years.
Okay. Do you, or what brought you to Matthew 25, I guess?
Well, actually, my husband and I moved from up north to Henderson, Kentucky in about 94. And we started to get involved with Zion United Church of Christ here in Henderson. And we met a great group of people. And one of those people we met was Cindy Burton and her husband, Luther. And she was in the process at that time of trying to figure out what to do about HIV and AIDS in our community. Mm-hmm. And my husband and I were part of the group that started brainstorming what to do about this issue. Mm-hmm. And then Cindy wrote our grant and got started. And my husband was actually the first president of the board for Matthew 25. Oh. And I volunteered on the side when I could because I was a stay-at-home mom. So that's kind of how we got involved.
And what keeps you motivated? What keeps you doing the work every day?
Our patients. I don't have as much patient contact as I used to. When I first started working for Matthew 25, I was part of our transportation team and food pantry. So I helped deliver food and I would pick patients up and drive them to their appointments. And so I really got to know a lot of our patients firsthand and really fell in love with a lot of them. And so that's kind of my heartstring. That, and I was, here in the beginning when we started out. It's just amazing to see where we are now from where we were then. And that's just what keeps me going. I love our mission and I love what we do.
And in terms of starting the work, getting further into the work and then falling in love with the patients and learning more about various individuals in the community and the community itself. What changes have you experienced yourself, just like learning more about HIV or what people are living with, and then strengthening your connection with the mission?
It really put a face on HIV and AIDS. I was in high school when the epidemic first started. So I was pretty naive to a lot of it going on. When you're in high school, you're pretty self-absorbed and not really paying attention to what's going on around you. So the more I got involved, the more it became real to me. And I just, like I said, the patients, I just really bonded with several of them. And I have a lot of empathy for them and compassion. And it just drove me to continue to be here. And I really wouldn't want to be anywhere else. So that's kind of why I've stayed around and just evolved with the organization.
Mm-hmm. And with the evolution of Matthew 25, can you give like a short description, or what do you remember like in those like maybe bare bones early days to where you
Early
are
days.
today?
Well, the early days we saw a lot of really sick people. Um, but it was very emotional and empowering to watch those really sick people come in and know that they're still with us today, a lot of them, or a lot of them have just recently passed away within the last 5 years. And it wasn't because, of HIV, it was because of other diseases, and they were older, so that's really neat to see and witness, because back then we weren't sure if they were going to make it or not. It's also really interesting to see how just the organization as a whole, and how much I've evolved here. I started out as a volunteer, then I became a staff member, and I drove our patients and helped them in the food pantry. And now I'm one of the leadership and have been for quite some time now. So that's just really cool, and it's really it's kind of neat because like last week, we had support group here, and a lot of those older core patients who I used to transport come to support group. And like I said, I don't get to see them very often anymore. And I just happened to be walking down the hallway and they were like, "Is that Sally? Oh my gosh, that's Sally. She's gotten older." Like I wasn't supposed to get older, I guess, but and we all hugged and caught up for a minute. And so that's really cool when that gets, when I get that opportunity to run into them in the hallway and chat with them for a while.
And in your leadership role, what are your everyday activities? What do they look like?
I oversee our community service team, which they they transport all of our patients. Here in Henderson, I have 4 people, I believe, that transport our patients. We usually have a position in Bowling Green who transports patients, and there's one in Evansville who also transports patients. We also do all of our food pantry operations. So in Henderson and Evansville, we actually have a food pantry where patients can come in, scan a QR code, look through exactly what's in the pantry that day, place an order, and then my staff will have it ready for pickup either after their appointment if they're just stopping by the clinic to pick it up. We also do a delivery program, a food delivery program for people who can't get to our clinic or who work during the day and can't get to the pantry during the daylight hours. We do that in Evansville, Henderson, and Owensboro. We take care of like nutritional supplements. So if the providers feel that a patient needs a nutritional supplement, my team orders that and makes sure that that nutritional supplement gets to the patient either by delivering it or when they come for their appointment. Trying to think, that's food pantry. And I also oversee our housing coordinator for our HOPWA programs and our TBRA programs. So that's kind of our team. Oh, and I have facility management too. I have someone underneath me who oversees all of our facilities and making sure special projects get completed and maintenance keeps up to date. And he helps oversee our 13 agency vehicles.
Okay. Yeah, I got a chance to see the fleet of vans when
Did you?
when I was there in March. Like we
Did you?
came out and we were like, wow, all these vans.
Yeah. Well, and now we have a mobile unit.
I
Our
heard.
prevention team has a mobile unit, so we've got that one too. Yeah. There's a lot of vehicles to keep up with.
Well, congratulations. It's, that evolution that you described. I definitely want to give credit to you and people and their dedication, their commitment to doing it when it was darker times and bringing it to the present. So thank you.
It's been a pleasure. It's when I first started, I pretty much knew every single patient we had. I definitely know I knew every single female we had because we ran a female support group that I would sit in with and help um, our case manager with. So I knew every single, if I didn't know the patient, I knew their name, but I knew every single female. And I mean, it's been several years now where I don't even think I know 10% of our patients anymore, so that's kind of bittersweet because I do miss that patient contact sometimes.
And correct me if I'm wrong, you all have a 10 county coverage area?
In Kentucky, yes, I think it's actually more than 10 county. I'm not sure on that.
Okay.
It's the whole pretty much western section. And then we have some of Evansville now too. So it's pretty big.
And from a transportation standpoint, what does that process look like? Say I'm a patient and I need transportation services. How do I?
Um, you would let either your case manager know, or when you were scheduling an appointment, you would let the front desk staff know. Depending on where your home location would be and which of our 4 clinics you would be seeing, would kind of depend on what that transportation would look like. Here in Henderson, my staff of 4 take care of what we call the tri-state area. So it's Evansville, Owensboro, and Evansville, Owensboro, and Henderson. And then in Bowling Green, we have a separate driver down there. So my coordinator, Nicole, would determine what type of transportation do you need? Are you eligible for a staff person to transfer you? Would you need, like in Bowling Green, we use Uber a lot, Uber Health down there. Would you need an Uber? We also have a shuttle service down in Bowling Green that we work with, a Medicaid shuttle service that transports sometimes for us, especially maybe long distance, like to Louisville or Nashville. Would she need to book a shuttle for you? So that's kind of what that looks like. So she determines which one of those 3 we're going to use. Then she'll determine which driver is going to pick you up. And then she communicates that to the driver, and she calls and lets you know the day before who's picking you up and what time they're going to be there. And they show up the next day to pick you up, take you where you need to go.
I'm curious from your experience of transporting patients to and fro. What are the characteristics that you look for your direct reports for folks who are you said 4 drivers? What are those qualities that you look for when you bring someone on the team?
Well, the big thing is, are they able to keep confidentiality? That's extremely important. Do they have boundaries? You have to be able to have good boundaries because you have to be able to say no sometimes to some people, because we only transport to medical appointments or mental health appointments. Or if you need to get some sort of paperwork to help you enroll in care, like maybe you need your social security card or, something like that, or you lost your driver's license, we could possibly help you with that. But we can't take you to the grocery store. We can't stop by the gas station so you can pick up a pack of smokes. You have to be able to have good boundaries and be able to say no when you need to. I also look for people who have some empathy and compassion for others. People that don't mind maybe working odd hours, because sometimes, if you have an appointment in Louisville, they're an hour ahead of us and it's 2.5-hour drive. So you might have to be up by 6:30 picking somebody up, or you might not get home from an appointment, exactly at 4:30 when it's time to quit. Those are the big things I look for. And of course, I'm really lucky because right now I have a really, really good staff and they've been with me for quite a few years. So, but I like hard workers, people that, don't mind getting in there and doing what needs to be done.
Mhm. And thank you for that. Because I was wondering if you had like ground rules or policies for drivers and then also ground rules for passengers. I think you kind of like spoke to that.
We do, we do. We have all of our staff, whether they're transporting patients or not, we have a list of policies that they have to follow and procedures that they needed to do. Like you can't show up at someone's house with a Matthew 25 t-shirt to pick them up. You know, we don't want to out anyone. And our patients, we have a patient transportation agreement that kind of tells them exactly what they need to do in order to stay on the transportation program.
Mhm.
You know, we like a 7 days notice as much as possible because it's not easy when, you know, you call this morning for an afternoon appointment, you know, it can be a little challenging because we might not have, I mean, there's times all of our drivers are on the road and we just don't have someone that can pick you up that last minute. So
And most of Western Kentucky is rural, right? And
yes, yes, very rural.
when you talk about drivers being able to maintain confidentiality, I guess I want to ask, what does HIV stigma look like in the region or in the area, or how does it manifest itself?
Um, you know, over the years that I've been here, I think it's a lot better than it used to be. Um, but you know, we still have, you know, depending on what side of the town you're from, you know, if you're from a little town that has only 1,000 people in it, you don't want anyone to know that you have HIV because everyone will know and, you know, by tomorrow. So it really depends on the patient. You know, some patients are very open about their status, but others are very private. So we always tend to lean towards being very more private and let it up to the patient to what they want to tell us or what, you know, if they're like, oh, you can pull up and drop me off here, you know, my roommate, no, you know what? We just leave it up to the patient. I do have one rule that was kind of impressed upon me when I started. If you're out and about in town and you run into a patient in the grocery store, I always tell my drivers, you don't approach them unless they approach you. You know, if they say hi to you, then you can say hi back. But if they choose to ignore you, then you just go on about your business and ignore them.
Yeah.
I just leave it up to the patient and how they want to do that.
Mhm. And that seems like that's informed by your experiences and know-how and knowledge. Um,
Yes.
how often do you feel like you get to impart your wisdom on fellow staff members or just people in the community?
I think a lot. I think you know, a lot of staff here know that I've been here for a very long time. Um, I think there's only 3 of us that have been here for um, 20 years or so. I'm the one that's been here the longest now that, you know, Cindy Burton left. So I think a lot of staff look up to me and ask my opinion, you know, or how would you do this? Or have you ran into this before? You know, and I get that from all different departments, not just my department.
And what would you want other people, whether it's your fellow neighbors or just people around the country, in terms of like whether they're involved in public health or not, what do you want them to know about Matthew 25, and what do you want them to know about Matthew 25's mission and the work that you're doing in your corner of the world?
I want them to know that, you know, HIV is not going away. Um, yes, we've made great strides in controlling the person's disease, um, but there's still stigma, there's still fear, and um, I just think it's really important to meet people where they're at and respect them, um, and not judge them. especially during this time right now.
Mhm.
Um, it's just really important to let people be people and meet them where they're at and not use judgment.
Like I would say, excuse the pun, but since we're talking about transportation, how would you like to steer forward or steer the organization forward? How would you want to steer the program forward? If you have your way, or just like in your leadership capacity. Um,
Well, when I first started, we had one clinic. And then in Evansville and Owensboro, we would go there once or twice a week, or once or twice a month. I mean, it wasn't very, very often we were over there. And since being here, we have a full-time clinic in Henderson, a full-time clinic in Bowling Green, a full-time clinic in Evansville. And then we're in Owensboro 2 days a week. And I know eventually we'll probably be in Owensboro every day. We have a pharmacy now. Uh, since I've been here, we had one food pantry in Henderson. Now we have two food pantries. We're going to get ready to open another food pantry in Bowling Green. Transportation. When I started, we had one vehicle. We have 13. I just feel like Matthew 25 has always been innovative and on top of whatever's changing in the community with HIV and AIDS. And I don't ever see us not being or evolving with the disease. So really the slate's clean with whatever comes at us. We figure out a way to do what we need to do to help people.
Mhm. And speaking of the food pantry, I know that, the social safety net is getting thinner by the day. But you all are still continuing to grow and continue to meet those needs. When it comes to the food pantry, what are the needs of various patients in terms of food and nutrients and just like calorie count? What does that look like?
Yeah, yeah. We try to keep like basic everyday things that patients may need. And we're actually in the process of kind of upgrading some of those basic needs after doing some surveys with patients. Um, some don't receive SNAP benefits, and are SNAP benefits still going to be here? Who knows? So it's really important to have those basics so that people can make food for themselves. We do a lot of canned goods, rice, peanut butter, canned tuna, canned chicken, whatever we can do. Sometimes we try to keep some frozen meat when we can get it. We try to keep frozen vegetables because we know those are better for you than the canned version. We try to always do low sodium items when possible. We also do like health and beauty. So we always keep toothpaste, toothbrushes, soap, shampoo if we can on hand because, HIV meds, like any other medication, can break down the enamel on your teeth. So it's very important to have good dental care. So we try to help out with that. We try to have some household cleaning products. Like we try to always keep at least laundry detergent on in the pantry. Just those little things that sometimes, SNAP benefits don't pay for. They're really hard, that can be really expensive. So we just try to give a good variety, the best we can for patients.
And you spoke about earlier, and also congratulations on the new mobile testing. Um, how did that come about? What was sort of like the impetus or the catalyst to make that happen?
Well, I wasn't totally involved in that, so I'm probably not the right person to ask. I know that Courtney and Anna and the prevention team, for years we've talked about it. For years we've talked about a mobile unit, but they made it happen, and they wrote the grant for the CDC, and we were when I was brought into it was when they were writing the grant, because we had to have a kind of an idea of how much it was going to cost us and where we were going to store what I call the bus, yeah, which is really like a big RV. So that's when I got pulled in to try to figure out how much it was going to cost us and where we were going to store it and what we needed to do for that aspect. And that's really the only process that I've had with the whole grant is just trying to we had to make a big RV garage for it, and it has to be temperature controlled, and so that's about all I had to really do with it.
Okay. Yeah, when we were there, we stepped out and it seemed like there were like people were working on maybe that garage or something that suited.
Yeah, it's completed now, and the RV's out there. So yeah, Nathan's done a great job making sure that's gotten completed.
I'm also curious from a philosophical standpoint, and I don't know, I think it's philosophical, but what would you tell your younger self?
I think I would tell my younger self that everything's going to turn out all right. When I first started it, I didn't make very much money. I basically did it because I had a passion for the people. It worked with my schedule for my children. And that was it. It wasn't about the money. It wasn't about anything. We didn't even have benefits back then. So I would tell myself just to hang on and everything will be all right. Because, now we have benefits. I make a decent salary, my children are grown. And it was a good experience for my children too, because there were times, where they came to work with me. They went to AIDS walks with me. They went to events. They were around people with HIV at a very young age. And so they're very accepting of all types of people just because they had a different experience, and they're both very empathetic and still believe in the cause 100%. So I'm thankful for that.
Thank you for that. Because you're a person of faith, I wanted to ask you, and please let me know if this is too personal, but what does Matthew 25 mean to you? In terms of like the scripture and then the organization's mission?
Well, I think it goes hand in hand. I mean, the passage is exactly what we do here at Matthew 25. You should be taking care of your neighbors. You should be caring for other people. And when the name Matthew 25 was developed, it was developed around that whole Bible verse. And I believe that's what we do every single day.